Recreational activities as well as home and work responsibilities make people of all ages leave their homes to go outdoors. However, even though outside activities may seem harmless, they can have associated environmental risk, especially for older adults. These risks include insect bites or stings, reptile bites, and environmental conditions. These environmental risks can also pose a threat indoors. After this lesson, you will be able to assess patients at high risk for environmental emergencies, prioritize first aid pre-hospital interventions for patients who have environmental emergencies, and recognize and explain plan of care for a patient with an environmental emergency established by the best evidence-based practices. First, we're going to talk about heat-related illnesses. Environmental factors are temperatures that are greater than 95 degrees Fahrenheit or greater than an 80% humidity. The physical factors include a patient's health status that can also increase the risk for heat-related illnesses such as obesity, heart disease, fever, strenuous exercise, seizures, and all degrees of burns, even sunburn. Medications or drugs, especially beta-adrenergic blockers, angiotensin-converting enzyme inhibitors, and thyroid medications and diuretics and illegal drugs can add to heat-related illnesses. Also, people that are at risk are older adults, homeless people, people who work outside, drug users, outdoor athletes, poor people, and military soldiers are most vulnerable due to decreased body fluid volume and overexposure to sun and heat. Let's discuss heat exhaustion and heat stroke. Heat exhaustion is a syndrome resulting primarily from dehydration. It is caused by heavy perspiration as well as inadequate fluid and electrolyte intake during heat exposure over hours to days. It is not a true emergency but can lead to heat stroke. It is caused from dehydration. They feel fluish. Patients maintain normal mental status. They may develop headaches, weakness, fatigue, anorexia, nausea, and vomiting. You want to assess for orthostatic hypotension and tachycardia. Move the patient to a cool area, stop physical activity, begin cooling measures, and offer oral rehydrating solutions such as Gatorade. They may require transport to hospital if symptoms persist. You want to monitor vitals and track temperatures. You want to rehydrate with normal saline if there's nausea and vomiting. You want to draw blood to check electrolytes. And in heat stroke, this is a true medical emergency in which the body temperature is greater than 104 degrees. Has a high mortality rate if it is not treated. Exertional, it's a sudden onset versus classic heat stroke, which occurs over a period of time as a result of chronic exposure to a hot, humid environment. Clinical manifestations include the body temperature staying above 104 degrees, mental status changes, hypotension, tachycardia, tachypnea. Complications run into multi-organ dysfunction syndrome, renal impairment, electrolyte and acid-base disturbances, coagulopathy, pulmonary edema, and cerebral edema. You want to monitor airway, breathing, circulatory status. You want to administer oxygen. You will give normal saline IV. You do not want to use lactated ringers. You want to continue cooling measures. You may need cooling blankets, iced gastric and bladder lavage, or iced peritoneal and thoracic lavage. You need continuous core temperature monitoring, and you will monitor aggressively to treat any seizures. Most snakes are non-venomous. There are two types of venomous snake families. There's the pit vipers and the coral snakes. Pit vipers are your rattlesnakes, your copperheads, and your cottonmouths. The coral snakes are bands of red with black separated by cream and yellow rings. So what does the venom do? It breaks down human tissue protein. It alters membrane integrity and impairs blood clotting. It leads to tissue necrosis, tissue swelling, intravascular fluid shifts, hypovolemic shock, pulmonary edema, renal failure, DIC, and or death. So let's discuss collaborative care in the field. Snake bites cause severe pain, swelling, redness, bruising, minty, rubbery, metallic taste in the mouth, tingling of the scalp, face, lips, muscle twitching, weakness, nausea, vomiting, hypotension, seizures, and coagulopathy. You want to move your patient away from the snake, encourage them to rest to decrease venom circulation, remove jewelry, constrictive clothing before swelling sets in, keep the affected area below the heart and immobilize the extremity. Do not allow them to have alcohol or caffeine. Collaborative care in the hospital will include supplemental oxygen, 2 large bore IV lines, normal saline, LR IV fluid, continuous cardiac blood pressure monitoring, offer opioid pain relief, tetanus for prophylaxis, antibacterial wound care. You want to obtain baseline labs, EKG. You want to get blood type and cross, coagulation panel, and a UA. You want to consider using an anti-venom, and you want to have epinephrine, antihistamines ready in case of anaphylaxis. Let's talk about arthropod bites and stings. These include spiders, scorpions, bees, and wasps. Almost all spiders are venomous, but most are too small to cause harm to humans. The brown recluse are found in dark, secluded areas such as boxes, garage, old clothing, and etc. Brown recluse spiders cause tissue necrosis at the bite site. Its rarely systemic effects is called loxoscelism. It's about 10%. This includes fever, chills, nausea, vomiting, renal failure, hemolytic anemia, thrombocytopenia, DIC, and death. Treatment is ice for the first 4 days, no heat, elevate the affected extremity, and wound care. Have them rest. If they're hospitalized, they may receive dapsone. It's a neutrophil inhibitor that prevents extension of crater lesions. They may need debridement and skin grafting to promote healing, and they may also need a tetanus prophylaxis. Okay, we're going to talk about the black widow first. The venom causes neurotransmitter release from nerve terminals. They're tiny, but their powerful bite is usually very painful. If it is systemic, signs and symptoms will occur within 1 hour. They're found in cool, damp places. The patient may experience severe abdominal pain, muscle rigidity and spasms, hypertension, nausea, vomiting are common. They may also include facial edema, ptosis, diaphoresis, weakness, increased salivation, respiratory difficulty, increased respiratory secretions, muscle twitching, and paresthesia. It's usually self-limiting and resolves in a few days. You want to place ice on the bite. If they're in the hospital, you want to watch vital signs, give muscle relaxants, pain medicine, tetanus for prophylaxis, and monitor for seizures. If an antivenom is available, you want to use it, but it's not used a lot due to the risk for anaphylaxis and serum sickness. Okay, now let's discuss scorpions. In the U.S., you want to watch out for the bark scorpion. They're venomous and they're neurotoxic. You want to tap the bite site. If it hurts more, that's the confirmation of a bark scorpion bite. It involves cranial nerves and musculoskeletal system. Ice the bite. Give Tylenol for fever. You want to provide wound care, and you will need tetanus prophylaxis. If they're hospitalized, you will monitor vital signs, prepare for intubation, and give oxygen and IV fluids. You want to give pain meds cautiously because you can push them into respiratory failure. If antivenom is available, you can use, though it is not used often. Okay, now we're going to discuss bees and wasps. They can be painful and cause anaphylaxis. They're capable of repeating stinging. The African killer bees are very aggressive. The local reaction is pain, and they'll have like a wheel flare reaction. Systemic manifestations include generalized edema, nausea, vomiting, diarrhea, destruction of red blood cells and white blood cells, platelets, damage to blood vessels, acute renal failure, liver injury, and cardiac dysrhythmias. Venom allergy signs are hives, itching, swelling of lips, tongue, and it can progress to anaphylaxis. You want to remove the stinger ASAP. Ice the bite. You may need an EpiPen. You want to monitor airway, breathing, circulation status. Monitor for wheezing, facial swelling, respiratory distress. Give an antihistamine right after you give the EpiPen. Transport to the hospital. At the hospital, you'll start IV lines. You'll monitor vital signs. You'll give oxygen. You want to have life support equipment ready. You want to monitor for several hours, especially if the person has more than 50 stings. If it is bees, try to outrun the bees. Honeybees can only sting once. Everyone else can sting over and over and over. Now we are going to discuss lightning. Cloud-to-ground lightning is the most dangerous. Energy in a single bolt of lightning can exceed millions of volts. The duration of contact is almost instantaneous flashover phenomenon. Can have direct strikes, splashing off of a nearby object, or traveling through the ground. Best treatment is to avoid getting struck by lightning. If struck by lightning, it can affect both the cardiopulmonary and the central nervous system. Strikes can cause a systole, and then apnea causes hypoxia and induced VFib. You want to provide care to those with cardiopulmonary arrest first. The patient can suffer serious myocardial damage. CNS damage includes immediate but temporary paralysis. They may also have loss of consciousness, amnesia, confusion, disorientation, photophobia, seizures, spinal cord injury, cerebral infarction, post-hypoxic encephalopathy, cerebellar dysfunction, and intracranial hemorrhage. Later on, they can suffer from fatigue, headaches, chronic pain syndrome, cognitive impairments, post-traumatic stress, blindness, ruptured tympanic membranes, cataracts, retinal detachment, fractures, or skin burns. These skin burns are called Lichtenberg figures, which are branching or ferning marks on the skin. Let's discuss cold injuries. There are two types, hypothermia and frostbite. Risk factors for hypothermia are cold weather immersion, acute illness, trauma, shock, immobilization, cold weather, elderly, barbiturate and phenothiazine use, alcohol intoxication, malnutrition, hypothyroidism, and inadequate clothing. So you ask, why alcohol? Well, alcohol is a vasodilator. It makes you feel warm so people start stripping, but they are actually losing heat in the process. Did you know that outside temperatures less than 82 degrees can induce hypothermia? Hypothermia is when the core body temperature is less than 95 degrees Fahrenheit. So we have mild, moderate, and severe. Mild, the patient will experience shivering, dysarthria, muscle incoordination, impaired cognitive ability, cold diuresis, which is peripheral vasoconstriction that results in shunting blood to the core, which leads to core hypervolemia and leads to increased urine output. Moderate and severe, they will have muscle weakness, confusion, and incoherence, decreased clotting, bradycardia, hypotension, decreased respiratory rate, dysrhythmias, decreased reflexes, decreased response to pain, acid-base imbalance, and then shivering stops in severe hypothermia. The vital signs will become depressed. They'll have an impaired ability to clot. The more hypothermic they are, the more likely to hemorrhage from injury and invasive procedures. So let's talk about collaborative care for hypothermia. You want to remove the victim from the cold. Remove any wet clothing. Apply warm clothing or blankets. And you want to use heating blankets, warm packs, convective air heaters, or warmers to speed rewarming. Now, if you're in the hospital setting, you want to monitor vital signs, consider withholding IV meds until the core temperature is greater than 86 degrees Fahrenheit, and be prepared to administer CPR. Okay, so let's discuss frostbite. This results from insufficient insulation from the cold. Frostnip is a superficial cold injury that may produce pain, numbness, and pallor of the affected area, but is easily relieved by applying warmth, and it does not cause tissue damage. Frostbite in first degree is superficial. Second degree you have partial thickness damage, and third degree you have full thickness damage. You want to educate patients to ask a buddy to watch for signs of frostbite while they're out in the cold. Have them get out of the cold and rewarm. If in the hospital, you'll provide a warm bath or hot towels to thaw the frozen area. You'll administer IV fluids and IV opioids. When frozen areas are rewarmed, elevate to decrease tissue swelling, immobilize. They may need a tetanus prophylaxis, and you want to monitor for compartment syndrome. For deep frostbite, surgical intervention may be needed. Okay, we're going to talk about altitude sickness. It's an acclimatization process by which the body adapts to less oxygen in the atmosphere. The three most common types of altitude sickness are acute mountain sickness, high altitude cerebral edema, high altitude pulmonary edema. All three result from hypoxia. Symptoms include throbbing headache, anorexia, nausea, vomiting. They can have tachycardia or bradycardia, normotensive or postural hypotensive. They may also have dyspnea on exertion and rest. The most important intervention is to descend to a lower altitude. For mild AMS, stay at a current altitude and wait to acclimate. In the hospital, you may give acetazolamide, and you might give steroids such as Decadron, and then you want to administer oxygen. Drowning is a leading cause of accidental death in the United States. Victims die by suffocation in a liquid medium. The suffocation results from aspiration of liquid into the lungs or laryngospasms with glottis closure, then asphyxiation. Prevention is the best intervention. You want to provide a safe rescue of the victim. You got to get them out of the water. You want to provide spine stabilization and establish airway and start CPR if indicated. Transport to the hospital ASAP. Okay, for review, step 1, rescue victim from the water. Step 2, start CPR as indicated. Step 3, get to the hospital. You need oxygen, intubation, CPR, decompress the stomach with the NG tube, monitor for pneumonia, acute respiratory distress syndrome, or nervous system impairment. This concludes the lesson of environmental emergencies. If you have any questions related to this lesson content, contact the instructor.